would like to thank you for choosing Scripps to have your baby, for allowing us to be a part of this really important time in your life. There can be a lot of anxiety associated with childbirth, and we have a team of experts here to take care of your every need.
I wanted to welcome you to Scripps Memorial Hospital at La Jolla. Our labor and delivery unit is very excited to take care of you and welcome you when you have your baby with us here on this unit.
If you think you're in labor, what you should do is call your provider's office. The provider's office will have someone, triage nurse or nurse-midwife, call you back and ask you some questions. The answers to those questions will allow us to give you the best advice about whether it's actually time to come to the hospital or whether you could stay at home a little longer.
So when you're still in early labor and you're at home, things that are really going to help you are a nice warm shower or a bath. You can try different massage techniques. Breathing exercises really help. You want to have candles, dim lighting, music, anything that's going to really promote you relaxing during this early part of your labor prior to coming to the hospital. You can try different positioning. You can try cat-cow. You can try slow dancing with your partner. If you've got a birth ball at home, try that. See what works for you in your situation and make sure that you're comfortable, you're relaxed, and you're promoting the most relaxation that you can. When you come to the hospital to check in for labor, you're going to start in a triage room. We're going to go into the triage room. We're going to put monitors onto your belly. We're going to listen to your baby and check to see how often and frequent your contractions are. We're going to do vital signs. We're going to check your cervix. And we're also going to see if your water has broken, if you think that it may have. Once we know that you're going to deliver, we're going to take you to a labor and delivery room. We'll admit you, and that's where you will stay for the rest of your laboring process until your little baby is born. Once your baby's born, we then have a 2-hour recovery time where you'll be in that same room, and then you will transition to your private postpartum room for the duration of your stay while you're here in the hospital. Right now with COVID restrictions, we are only allowing one person to come into the hospital with you. You are allowed to choose whoever you want that support person to be during your stay. However, it is a good idea to call ahead and get the most accurate information on the restrictions that we have in place right now. All right, it's time to go to the hospital. Pack your bag. You want to have things that are going to make you feel comfortable while you're at the hospital. So that would be slippers, pillows, toiletries, anything for your little baby, as well as some snacks for your support person. Scripps provides birth balls in every room. We have peanut balls. There's a shower that you can utilize during your labor. We have diffusers with aromatherapy. We have flameless candles, and we have televisions in every room that have a variety of music channels that you can listen to while you're laboring in the hospital. The nurses will provide the best support possible for you while you're having your baby here at Scripps La Jolla. We are very well versed in all the different position changes, maneuvers, techniques to help facilitate and optimize labor while you're here with us.
Depending on the circumstances of your labor, your baby may be monitored intermittently, so off the monitor sometimes and on the monitor others. In other labors, we may need to monitor the baby more closely. In any case, we have monitors that are with wires that have kind of a short leash, but we also have wireless monitors that allow for more mobility of patients. This is helpful because often patients feel more comfortable if their mobility is not limited. So we're trying to encourage them to be able to move about as much as possible. First of all, I'd like everyone to know that our main goal is to allow labors to progress as naturally as possible. However, sometimes that's not happening, and we have many options of ways that we can help your labor move along. That may include medications, which could either be oral medications or intravenous medications. That could also include a mechanical type of dilating device that we use to help the cervix to open. Those options will be discussed with you with your provider should that become necessary. If we decide that the safest way to deliver your baby is through a caesarean delivery, we have operating rooms and a dedicated team of nurses and doctors to take care of you during that experience. This includes having your support person with you in the operating room in most cases, as well as being able to have the baby skin to skin, just like you would in a vaginal birth, after the baby's been assessed. Our goal at Scripps La Jolla would always be to keep mothers and babies together as much as possible, especially during the first critical hours. However, sometimes that's not possible, and for the safety of the babies, we have a level 3 nursery staffed by Rady Children's nurses, physicians, to provide excellent care for those babies that might need that.
From myself and all of the nurses on our staff, I just want to say thank you for choosing Scripps Memorial Hospital La Jolla to have your baby at. We are so excited and honored, privileged to be a part of this special day in your life.
On behalf of myself and my colleagues at Scripps Memorial Hospital in La Jolla, we are honored that you've chosen us to help take care of you during this special time in your life. Thank you. We look forward to seeing you at Scripps.